The Spanish flu. One of the first recorded pandemics that affected the Philippines was the Spanish flu, which, despite its name, did not come from Spain. Also known as the 1918 influenza pandemic, the disease was caused by the H1N1 influenza virus with genes of avian origin. It being a new strain on humans meant we had no resistances or immunities against it. There were also no antibiotics or vaccines available at the time. Control efforts worldwide were limited to non-pharmaceutical interventions such as isolation, quarantine, hygiene, and limitations of public gatherings. The Spanish flu was coined only for the fact that Spain was the only European country where the press were printing reports of the outbreak, which had killed thousands of soldiers fighting in the First World War. Other countries at the time suppressed the news in order to maintain and protect the morale of their people. During the final months of the First World War, the dirty and cramped living conditions of the soldiers caused the Spanish flu. At the end of the war, the soldiers began returning home, bringing with them a deadly virus that would soon plague the world. The Philippines, being a colony of the Americans at the time, was bound to have a slice of the pandemic's statistics. Now, how did the Philippines fare? In 1918, a second wave was reported in an issue of Manila Times. It mentions that the second wave was less severe than the first. However, due to the dismissive tone and lack of seriousness of these articles, it also gave misinformation to the public about its severity. Francis Hialogo, a Filipino historian who studied the Philippines' response to the Spanish flu, stated that the government stopped various forms of outdoor movement. Sea and land travels were prohibited, amusements and malls were closed, and schools were used as temporary hospitals while the teachers helped the patients. The Philippines had problems in retaining personnel due to resignations, retirement, death, and military exigencies. A system of quarantine was implemented, but it failed to check for entry of disease, and thus it spread. In the end, approximately 85,000 of our people died.
We need more healthcare workers. The transition of power from the United States to local authorities didn't help, as they were already having a manpower crisis. Sounds to me like the United States was appointing responsibilities. On top of that, some government staff were quitting at a time where collective effort was most needed. Communicable diseases easily spread in densely populated places and gatherings. Many people and infectious virus results in many infected. Clusters of people easily become the virus breeding grounds. Wearing face masks during travels can lower chances of infection. Dole's case study revealed that a 48-year-old Caucasian committed a fatal mistake of not wearing a mask while talking to his seatmate during his air travel from Bangkok to China. He had developed diarrhea 2 days after his arrival, then 2 weeks later died from the disease. Always practice caution and follow health protocols, especially when a deadly disease is rampant. After all, people die when they are killed.
Swine Flu 2009. Increased protection for vulnerable people and people with underlying disease. Fortunately, the world had a vaccine developed during this outbreak. While we must prioritize the vulnerable people, it is still important to protect ourselves from the disease. For your own safety, follow health protocols and always exercise caution.
While COVID-19 is not as deadly as previous outbreaks, it killed the economy and the people's way of life. Small businesses and private schools closed. The country's inflating debt, higher than Snoop Dogg. Healthcare protocols, more broken than League of Legends. How ironic it is that a disease with such a low mortality rate flipped the world upside down. We were all obliged to stay at home indefinitely while some other police chief went ahead and celebrated his birthday. So, how did we fare against COVID-19?
1 year later, what the virus has done to the Philippines is no joke. Small businesses had to close. Schools had to adapt to online learning. A lot of people lost their jobs. And some were even stranded far away from their families. What have we learned from the past? Did we even learn anything at all? People are left fending for themselves. Some even found ways of helping others to the best of their abilities. Community pantries, small stands with supplies ranging from food, hygiene products, and clothing were being established in some barangays. From the neighbor to the neighbor, the spirit of Bayanihan lives on. More fortunate people donated to charities and fundraisers, and the government even made a small beach along the coast of Manila Bay. Spreading awareness and proper information dissemination is a good start. There is a saying on the internet that knowledge is power. This holds true in real life as well. If you are equipped with the right information, you will eventually find a solution. Having knowledge about something is better than being left in the dark. Educate the public. No, the vaccines will not give the government mind control powers over you through 5G towers. We don't even have proper and stable network connections in the first place. Fake news and misinterpretation in social media has become rampant. It is of utmost importance to develop critical and educated thinkers from a young age for them to have the ability to distinguish what is fake or real. Misinformation does not just discredit people, it also incites panic to the public, making the situation worse. The difference could mean life and death.
Invest in science, technology, and medicine. The cost of healthcare and medicine is very expensive, with vaccines and hospital fees inflating over time. The more careless we become, the more people get put at risk. Those privileged enough to handle these repercussions directly put those that cannot at a disadvantage. The current pandemic revealed how little our country invests in science and medicine. As a developing country, our government is more focused on economic and infrastructure development, and we have neglected sciences and innovation. We rely on other countries for vaccine development and production. Invest in research facilities and medicine. They will not only prepare us for short-term solutions, but cultivate a nation that believes in science and the curious youth. At the end of the day, we were not prepared for a pandemic. The results of our actions and poor decision-making are a testament to that. However, instead of wallowing in self-pity and pointing fingers at one another, we should start changing not only how we handle nationwide problems, but also how we think as a people. In the event that another pandemic decides to pay the Philippines a visit, our country should be able to handle it with proper research, quick thinking, and compassion.